Yes, good morning. Happy Friday.
We are so glad to be here. I'm pulling up our presentation now for you guys. So as you can see, like Tashina said, we are going to be addressing resiliency, overcoming stigma and discrimination. So once again, we want to thank Philly Fight for this opportunity to conduct a webinar with you all today. Like she said, we did a webinar this past Wednesday where we focused on grief and loss and just kind of going through the impacts of that. And so today we really want to focus on resiliency. And essentially, when I think of resiliency, I think of being able to bounce back from adversity. What would you share with that?
I think when I think of resiliency, I definitely think of it as an action word, right? Like, so taking action. I think it's one thing to be strong and to be able to manage things that come our way, but to be resilient is to take action and really step into that world to make a change. So super excited to talk about that today.
Yes. So of course you see, I'm Brandy Walker.
I'm Stacy Heath.
And we have our third partner, Armina Domingue, who presented this past Wednesday. And in that short period of time is now under the weather. So she's listening in, being our support one here. So let's jump in here. So our objectives for today's webinar. So one, we'll be focused on coping with stigma and discrimination, primarily in treatment and care. But then we'll also be looking at the impacts of supporting community-based initiatives that challenge stigma. So right now we want to take a pause just to get your input and utilizing the chat box. And so we want you to put a 1 in the chat box if you have faced stigma or discrimination while accessing healthcare. So again, put a 1 in the chat box if you have faced discrimination or stigma while accessing healthcare. So we'll give you a moment just to do that. Anyone who has faced any stigma or discrimination while accessing healthcare, drop a number 1 in the chat box. Next, we want you to drop a number 2 if you're connected to or know of a LGBTQ plus affirming healthcare provider. So someone who is knowledgeable or trained to treat members of the LGBTQ plus community.
For sure.
So drop a number 2. Oh, that's awesome. I'm seeing a lot of 2s. This is wonderful.
Yeah, there's a few number 1s in the chat, but I think, very refreshing to see all the number 2s popping up, to just know that there are providers out in the community that are accessible and that folks are aware of them and can access those services in order to not feel the discrimination and stigma when trying to access healthcare. So that's good to see.
Yeah. Lastly, drop a number 3 in the chat box if you are seeking an LGBTQ plus healthcare provider. So you may not have gotten connected with one, you've been, looking for one, or you're interested in connecting with one. Just drop a number 3 in the chat box if that's you. But we're excited to see some of who we have joining us in this webinar today. Okay, I don't see any 3s.
Okay, so that's a good thing. So maybe folks are connected. Great.
That's awesome. All right, so we have our objectives there, but we wanted to, again, take a pause before jumping into that first objective and really talk about what are the stigmas. And I'm sure you guys have some specific stigmas that you might have experienced individually, but we wanted to kind of highlight some of the ones or most prevalent ones. when we talk about accessing healthcare. And so as you see it here, we have, fear of discrimination. So if we're thinking about that, for you, what comes to mind?
I think for me, thinking about fear of discrimination, again, like being able to go into your provider's office and just having that fear that the provider is not going to want to treat you, right? Just based off of your presentation, maybe it conflicts with their standards or what their expectations are. And so just based off of that, like not understanding your needs, your resources, and just really refusing to give you treatment, I think that can be very overwhelming for people.
I always think about providers' personal beliefs.
Right. Yeah.
And so Stacy and I are clinical therapists for mental health. And so, we've always been trained, our personal, beliefs have no bearing in the counseling space. And so with healthcare providers, when you think about, your values
and your moral compass and just kind of like what you deem to be like a standard of care at times, medical providers, I think for a host of reasons that can conflict with what their patients need. And so when those things present themselves, they definitely can discriminate against patients. And sometimes it may not even be intentional.
Right.
They may feel uncomfortable, right? They may feel like they're providing healthcare outside of their scope of what they understand of what the patient needs, but they just don't have the right language or the right way to communicate that, making the patient feel uncomfortable.
And so I know what we've always been taught is that we are to practice in our competency. So we are to practice in what we know how to treat. Anything outside of that, then we need to refer out, to someone else. But this is a fear, of individuals of this community, of going, and other communities as well, as we know, of going to a healthcare provider and potentially being discriminated against.
When you mentioned that just now, it just kind of like popped into my head. I thought about, for young people and young adults, right? Like they may have a family provider. So think about if you had the same doctor for a really long time, and then you do kind of change your lifestyle, you do change your identity, and you become more comfortable within yourself. That doctor who's known you in this way for so many years, right, may discriminate. And again, maybe not intentional, but they've just accustomed to one way. So I think that's, a real fear for folks trying to access services.
So I think that kind of feeds into this fear of being outed.
Yes.
Especially if you have grown to build a certain relationship with your healthcare provider.
Absolutely.
Which, I think that's an important piece. And we'll kind of get into some of that later in the presentation, is that relationship with your healthcare provider plays a very crucial part.
I remember early in my career, just being kind of like a youth worker, youth advocate. And I remember we did a lot of work with Planned Parenthood. So this kind of reminds me of that a little bit, where we would have young people come into Planned Parenthood because they couldn't go to their family provider because they wanted to access birth control, right? Or access condoms, things like that. And so there was this fear, if I go to my doctor, they're going to tell my parent, right? So I think that kind of resonated for me. If a person is connected to their provider and they are having thoughts or feelings and trying to like figure themselves out and really understand their own identity, having that conversation with the doctor could potentially, cause them to be outed to family members when they're not ready.
That's right. That is so true. So another stigma is the lack of knowledge about LGBTQ plus health, right? And so we were kind of having this conversation earlier in preparation for this presentation, just about the more so about what some of those health issues or things or changes that individuals in this community may want to pursue, and
healthcare providers not being able to either provide that service to them, have knowledge of what they need. I think when we're talking about like just like medications that they may need,
Yes, yeah.
if they're looking for like reassignment surgery, things of that nature, and healthcare providers not being knowledgeable may not direct them in the right place, but also may just refuse to treat them because they don't know. So that becomes a challenge as well.
Yeah, yeah. And so another big stigma is this unsupportive environment. And that's a big part for us, especially being in the counseling field, and taking in people who are having courage and being brave to be vulnerable. And this is the same thing, I feel like, for this community in general. But not only for this community, but just in general.
Yeah,
you know,
I think we saw that over the course of the pandemic.
Yeah.
That was a big thing with healthcare, just how communities of color, low income communities could not access the same services, right? There was a big push when the vaccines came out, and just like there in certain communities there was overflow, and there was like they had vaccines, they were dropping them, they were spilling them. And then you went into certain marginalized communities where there was not enough. And and so people of color, and again, low income communities, they could not access what they needed, and they couldn't go into those medical providers and feel like they were being heard, they were being valued. So I think that's a big thing, as well, just for all people, just to be thinking about that, what are our healthcare providers providing to us, right, in our communities, and are we getting the same access to services and the same support?
Yeah. And when you're finding these providers, right, going into their spaces, first impression is everything. So the moment you walk in, how you're greeted, a lot of that plays into a person feeling safe. And if we're talking about anything health-wise, our bodies, these are our bodies. So, these are very sacred spaces where we're, again, being vulnerable. And so this is a big stigma, going into a place and just not feeling supported or not feeling wanted, or cared for.
I think in the medical offices, and it's kind of like unfortunate because you see it now, like this is Pride Month. So, when you're out in the community, I've noticed for us, like being in downtown Dover, you go and they have the decals in the windows, right, in the stores that say like, this is a LGBTQ safe space. So people know they can come in, they can patronize the space and be safe. And I think, sometime when you go, I know I've used my healthcare provider down in there, and they'll also have the decal, right, which is the flag or something, just to show that this is a welcoming space. So I think it also allows for other patients to also know, right, like this is a welcoming space, this is a safe space, and there's an expectation that no matter who comes into our doors, they need to be treated with respect. So I think that's super important when you're looking at a provider and the environment.
Yeah, you just brought up a good idea. I mean, a good thought there, just because, the staff can be very supportive, right? But the patients, other patients, may not be as welcoming or courteous or polite in those spaces. And I think that stands for any environment.
I think so, for sure.
Yeah. So those are some of the prevalent stigmas, and I know that there are probably so many more. But of course, with stigmas, there are impacts, right? There are consequences to these stigmas. And as you see here, as a consequence of some of those, people go without getting treatment.
Yeah, for sure. And I think that's the greatest negative impact of stigma is that, because of how you identify, essentially prevents you from getting treatment, right? For like you said, like chronic diseases. So people are, living with cancers and maybe living with, HIV, things of that, like really, really chronic disease. And they can't just kind of go to their provider, feel safe and get what they need. And so they kind of suffer in silence, right, in their homes, and they just deteriorate, which is completely unfortunate. But it's unfortunately a reality.
It is a reality. Yeah. And so as you see, it's lower rates of preventative care. And so that's a big push in our society is, go get all of these things done on an annual basis. To make sure that you're in good health. But if they're experiencing stigmas, that's of course going to make people avoid.
Right. And then that's a good point that you said, like the annual care, right? Preventative care. Because I see, I think Armina popped in the chat and just kind of mentioned like Bay Health, right? Like the bigger hospitals definitely have signage to say that they're affirming spaces. But when you're at the hospital in the emergency room, it's kind of like, is it too late? Like, you're already in a crisis. You want to be able to find spaces within the community where you can get that preventative care, where it's personal, where you have a connection to a provider, where you can go annually, they know you, you can talk about medications, you can talk about just other things. I know when I see my doctor, not only do we talk about my healthcare needs, but they tap in, like, how's work going? Like, how is it juggling? I relocated from New York, like, how are you adjusting? So those kind of personal things you can also bring to that space, which makes your medical care and how you feel about yourself, that much more engaging. So if people are not able to access care like that, it really creates a disparity in the healthcare.
That's a very good point, because that shows an investment on the healthcare provider, investing in their patient.
Absolutely.
And I think that goes a long way, because I don't know about you, but in a counseling space, when I'm counseling clients, I want to know about everything.
Yes.
I want to know about everything. I want to know about their supports. I want to know what they do for fun. I want to know about all of those different things. And if there's any areas that I may not be privy to, I also want them to educate me on those areas, because the goal is for me to get a good sense of who they are as a whole being.
Absolutely. And I think when you think about healthcare, that's important, because if you're coming to your medical provider and you are getting diagnosed, right, with a chronic illness, as your medical provider, they want to know what your world looks like, right? Who are your supports? Are you getting this diagnosis and then going home to an empty house? Or are you going home to a loving spouse? Are there children? Like, how does this medical situation impact the rest of your life? So I think that's so important, that it is personal and not just like the sterile hospital where you're like just a number in the emergency room, right? And you just have to kind of like move through life.
Of course. And so the other piece of this, and again, this is not an exhaustive list, but suicide, suicide in the LGBTQ community is already at an influx. But when you're talking about not being able to access or not feeling comfortable.
And getting the support that you need. So if you don't even have access to care and you don't feel supported in the environment, then you're sitting right at home or sitting in those spaces. And I know, like you mentioned, as clinicians, we want to know, but again, like when you go to your medical provider, if I say to my medical provider, like, I've really been low lately, or, I really don't feel like doing anything, while they're not a clinician, they do have some tools to assess. Right. So if you're not accessing care and you can't get those screening tools done, then you're not even being directed in the right place. And so you may be having those feelings and those thoughts, and then the not having an outlet definitely makes it more prevalent, and you would probably act on those feelings.
That's right. That is so true. So we wanted to highlight some of that before going into this first objective. And we have some charts here that we wanted you to just kind of view to be able to see what responses, are being said or being put out there with.
Right. So I think that's important, right? Like the charts are highlighting, folks in the LGBT community compared to folks that are not within the community. They are at a higher rate of having a negative experience with their provider, right? That the providers are assuming things about them that may or may not be true. Healthcare providers are dismissing their concerns and not even willing to engage in those conversations because of their own views, their lack of knowledge. And so again, making it just really, really challenging for folks in the community to get what they need, feel supported. And I think the data that's out there just really highlights that. And so it's important that we educate our providers as well.
For sure. And then we have the health insurance rates. And this chart is kind of showing that lag with LGBTQ people of color. And so this is what we were talking about.
Yeah, just like accessing, right? Like just being, having those providers even reaching out and saying like, hey, do you have healthcare insurance? But I think what we were talking about was just the fact that like, even within the insurance, it doesn't cover the things that they need, right?
Exactly.
So if you have to pay out of pocket anyway, then are you going to sign up for healthcare insurance, right? Like, so there's just that lag that in the LGBT community, healthcare insurance providers are not even outreaching and saying like, hey, let's make sure you're signed up. Hey, let's make sure that our insurance plans are covering the things that you need. So I know, like with hormone drugs and reassignment surgery, like those are things you hear typically people have to pay for out of pocket. So again, you know, the insurance companies are not taking this community into consideration when they're looking at the things that they're offering. So it's very unfortunate. And again, I think just the numbers in the graph just highlight that to make us more aware.
Yeah. And I think it's essentially an ongoing process with insurance companies. Because again, we're tailoring this presentation to this community, but overall, there are a lot of things that when we talk about insurance,
I think for me, I think personally for me, being a woman of color, I know when I tried to seek dermatology services, right? So a lot of things, I had like some hormonal issues going on, and I needed a dermatologist that could respond to that. But the treatments that I needed were not covered within my plan. So it was very frustrating, right? So being able to get the diagnosis, being able to understand what was going on, but not being able to access the treatment, right? So it was very frustrating to pay out of pocket. And so I think that's the thing that where insurance companies, you know, definitely need some policy work and some changes around what they cover.
So this kind of highlights that it's in addition to stigma and discrimination, there's definitely changes that need to be made just with health insurance and coverage as well. So we know that coping with stigma and discrimination, and we saw your responses in the chat box, just stating that, you know, a good portion of you have experienced some type of stigma or discrimination while accessing healthcare. So we want to take a moment to kind of go through some of the ways that you can kind of navigate some of these difficult situations. And then there will be a piece of this after we kind of go through these bullet points where it's not so much what you can do, but more a general statement of what needs to be done.
Right, and how providers can also help.
So the first thing would be to educate yourself with anything like we were just talking about, you know, healthcare and things of that nature. With anything, you need to be familiar with what's out there already.
Right. So I think that first question that we asked, right? Like, who are you familiar with? Do you know where there are providers that you can access? So just learning what's already in the community so that when you go to access services, you go to places that make you feel comfortable, that are affirming for you. And what are your rights as a patient? I think that one, for me, really stands out because I think we feel as people when we go to access healthcare service, we're at the mercy of the doctor. And that's actually not true, right? Like, we're not at their mercy. We need to know what our rights are. And there are certain things that providers can't deny us of, or ask for payment for, right? And so we need to know that walking in so that we also can advocate for ourselves.
There's a lot of power. As they say, knowledge is power. And so the more you know, especially with regards to any professional that you're going to, or just healthcare in general, the more you know, the better,
right?
Because you know it gives you that upper hand of what's acceptable and what's not. And many times people can get over on us just because
we don't know.
We don't know. And I know that takes time and commitment to research and learn. And
well, we have Google.
Yes.
Google is our friend, right?
Google
like
is
Google
our
can
friend.
teach us a lot of things. I think the other thing is sometimes we go into spaces and we know we weren't treated right. We just don't know how to follow up.
Right.
Right. And I think that's the key. So knowing like if it's a healthcare provider, if it's a dermatologist, if it's a dentist, right? Like what are the governing bodies that kind of manage their policies and ensure that people are being treated fairly? So so doing a little research, educating yourself so that if you are treated unfairly, if you experience any kind of stigma or discrimination, who to report that to.
Yeah, you'll be easily able to recognize the wrongdoing.
Yeah.
And then knowing, like you said,
and seeing that follow up. Yeah, because I think that's how healthcare providers kind of get away with that stuff. Yeah.
And so we have seeking support, right? Because, and I think that kind of feeds into knowing what to do.
Yep, knowing who to reach out to. Yeah.
Because as we get into the end of our presentation, of course, there are a plethora of resources and organizations that have this information, right? They have this information. They know how to navigate spaces that some of us may not know how to navigate. And so sometimes it can be very helpful and beneficial to connect and partner with others. Right. But also connecting with people who have also experienced the same. I think even just in the chat box, just to see individuals who were able to identify like, yeah, I have experience.
Right. And I think when you are experiencing that, it feels, and we talk about this a lot, like in that moment and in your situation, you feel very alone. You feel very like this is only happening to me. This is a me thing. And there are so many people sitting in that same space, and there's power in knowledge, there's power in numbers. And sometimes when you recognize like, oh, this isn't just happening to me, and how can I get back to resiliency? How can I take that information to create some change? But I think so seeking that support, connecting with others that are either accessing those services, using that provider that aren't feeling safe, to really kind of create some change.
Yeah, because outside of that connecting and joining in the same experience, some people have overcome already. They have overcome, they have learned how to navigate through difficulties with accessing treatment and care. And so then they can be sort of like a guide to help. So that's important, just to seek that support. And then we kind of touched on this earlier when we were talking about open communication with your provider. So relationship with your provider. And so as you see here, being open.
Sharing like when things are happening and being honest with that provider and saying like, hey, this isn't the appropriate language, or hey, I noticed like in your waiting room, some of the things that you have up are really offensive, right? Or maybe your front desk staff, was using offensive language, or just I could tell like facial expressions. Like I think when you bring it to their attention again, I try to live in this very, lollipops and fairy tales world, right? Like I want to believe that everyone is coming from a good heart. So I want to always move with this space that this was unintentional and you didn't know, right? So I want to hold you accountable for your behavior, but I also want to make sure that that there's another option, there's another way, a better way. And the only way to do that sometimes is to communicate that. People don't know that they're doing things that are offensive sometimes.
And that is true. And I will say, you can be very open in your communication, but also pay attention to the response, right?
Yes, absolutely.
Because the response will tell you a lot about the provider, about their willingness and openness to be open to you.
Yes.
So, I think that piece is important too.
Yes,
so
absolutely.
You'll convey your concerns and specifically concerns about any discriminatory behaviors or any stigmas But then based off of their response, you know, that's a part of what we have to do. And we tell our clients to do the same. I always tell clients that looking for a therapist that is suitable for you is almost like, it's like shopping for a car, in a sense. You have to keep looking until you find exactly what you want.
And what's going to meet your needs. Specifically. Sure.
And where you feel safe. I think that's the biggest part. Like we said, you know, these are our bodies that we're talking about. This is our livelihood that we're talking about. We're talking about living. And so we want someone that's really going to take the time and the care necessary to treat us
based off what we need, not off of their own biases.
That's right. Yeah. So then we have empowering yourself, of course. And I think just in this process, if we're talking about stigma and discrimination, that can weigh on you.
Yes, very, very heavily, because again, when it's happening to you, you feel alone, right? So you're in the office with the doctor, or you're at the front desk, and this is happening for you right now. And how do you experience it and challenge it at the same time? Right? Like how you're making me feel so horrible in this moment, but I also have to find resiliency and the strength to advocate for myself, right? And sometimes it doesn't happen. Sometimes you have to kind of endure that, take a step back, and then come back to say, like, this is what happened. But I think empowering yourself and being able to use your voice is something that you definitely have to work on and understand. If you don't speak up, then there may not be change.
Yeah. So this is really also talking about just the knowledge, power that comes with being knowledgeable. So if there's anything in particular that you're really focusing on, you got to do your research. And that's that commitment to the time and wanting to learn. Because sometimes, again, if you don't take the time out to really research and learn what you need to learn about whatever condition you may be experiencing, and also, again, like the treatments, what type of treatments, because you also, that's going to be important for when you're looking for a provider as well.
Because I think you mentioned earlier, you know, as therapists, we are very clear when we meet with clients, like, if this is outside of my scope, if this is kind of like beyond my capacity of expertise, I want to refer you out because I want you to get the treatment you need. So I think in doing research, again, providers it may just be outside of their reach. And so they're maybe at fault for not articulating that properly. But you want to research that and know that, because they also may be using that as kind of like a protector for them. Like, oh no, I don't know how to do that. Or no, that's not my thing, right? When they actually do it in other spaces. So definitely wanting to educate yourself about the provider and what they can and cannot do.
Yeah. I think those are very important pieces. This part is most definitely important when we talk about developing coping strategies. So knowing what's going to work for you. And I think the important piece to identify is when we talk about stigma and discrimination, that's going to bring a lot of different emotions. Like you mentioned a minute ago. It's
being in that space and in that moment. You know, I know in my practice and talking to my clients, just in talking about coping strategies in general, for me, grounding, right? Like when I go into spaces that trigger my anxiety, or just like I feel frustrated with Dunkin' Donuts every morning, I try to ground myself and say, okay, today's going to be positive. I'm going to make my order. So I think it's the same thing when you go into your doctor's office, right? Like maybe you know the space is not affirming. Maybe you know they're not quite there yet. So what are you doing when you have to enter that space? How are you regulating yourself? How are you regulating your emotions? So doing some relaxation techniques, thinking about your breathing, thinking about your response. I think a key part of a coping strategy is the education piece, right? Because I think when you know what you know, then you can articulate yourself better. When you don't know and you're not quite sure, you're frustrated, they're frustrated, And I think that also makes for a difficult experience.
Yeah, it makes you more susceptible to have to go with what's being said.
Right.
Because you don't know right off the bat. And it's not to say that we're going to know everything
right
off the bat, but it's just to say, okay, something is being said to me. It's making me feel uncomfortable. It's making me feel frustrated or upset. So let me take a step back and let me look into this more. Because one thing about it, whatever is said to us, and as you know, with many providers, a lot of people talk about getting second opinions and third opinions.
Yes.
So it's not the end all be all with just one provider. So you do have to, again, recognize how what was just said made you feel,
right?
But then take a step back so that you can kind of tap into that logical side of your brain and say, okay, how do I want to navigate?
Right. This? And what are my resources? What are my options? And I think that's the biggest piece of knowing what are your options, right? Because one doctor, like you said, that's not the end all be all. You're entitled to a second opinion. And that kind of feeds back into, what insurance you do have, what are the benefits that are in place, so that and when you have all that kind of stuff in your arsenal, then you know how to proceed and you can move with more confidence for sure.
Yeah. So again, just knowing what works for you. Again, on the slide, this is an exhaustive list. For some people, taking a moment and listening to their favorite songs is helpful. For some people, they need to take a hot or cold shower. For some people, they just need to take a walk.
Yeah.
And have no noises at all except for the nature.
Sure. Yeah. That works for me.
And so it's very important to identify what are the things that I truly enjoy. What are the things that truly bring me relaxation and peace, so that when frustrating moments occur, because they will occur, because this is life, what can I tap into?
Yeah. And I think another big piece of that, like we talk about seeking therapy, right? So obviously we're clinicians, so we're going to promote that all day, every day. But I think from one healthcare professional, when you're seeking that professional service, I think we also have a different level of understanding and expertise in thinking about how services are accessed. So I know for me in my practice, when my clients come and they are struggling with healthcare providers or health concerns, right? Like I'm always thinking about, as a patient, accessing services, but I'm also have some knowledge. So I'm also thinking about, wait, are your rights being violated? Right. So I think seeking a therapist and a person that's within that kind of background space will also help you as the patient have a better understanding and maybe, get some technique, some language, so that when you go speak to your provider, you can kind of move in that confidence as well.
Yeah. It does. So that goes back to that education part. Education part, seeking support from people who can guide you and direct you, because there are people who have similar experiences but have overcome or have moved a step further. Yeah. So then we have documenting incidents. So this is an action step. So you
definitely
talked about
an action step.
Resiliency being
an action word. Yes, absolutely. I know, again, kind of just personal account, being an elder child, watching my parents kind of go through different medical situations. One of the very first pieces of advice that I was given going to appointments, and I give this religiously to clients, get you a notepad specifically for the doctor's visits. I have a lot of clients who are dealing with parents that have cancers and stuff. Write stuff down, because it's a lot of information coming at you. It can be very overwhelming. So kind of like document that also. So, like on this day, the provider told me this.
Right.
On that day, the provider, right? So if those things start to conflict, you have like some tangible go back to review. And then I think, again, when something doesn't make you feel comfortable, or you feel like your rights maybe were violated, or you just weren't treated right, document that,
Mm-hmm.
that taps into what you call your rational mind, right?
Yeah.
Move away from the emotion, but kind of document what
Mm-hmm.
happened. So when it's time to report it, you know exactly how to communicate that.
Yeah, so it's coming from a stance of being proactive.
Yes.
Because most of the time, if something were to happen, then you could probably sit back and think, oh, that happened to me a couple months ago.
Mm-hmm.
But you may not recognize all the details or recall all the details of what took place at that time. So it's important to note, you know, when you're taking your notes,
Mm-hmm.
you know, the date, the time,
the location,
you know, all
who
of
was
those
in the room.
Yeah. What were the details of what happened?
Mm-hmm.
So that if you should ever have to go back to it, then
you have that information. Yeah,
you have it already. Mm-hmm. And of course, as we know, with our legal system,
yeah,
you got to have some sort of proof.
Yes.
So the documentation can go a long way mm-hmm. in those situations. And then, of course, like we mentioned before,
reporting that discrimination, knowing who to report it. And I think when you report it, that's going to be critical. They want the facts, right? I think mm-hmm. that's the other thing, is that we get caught up in our emotion and we're calling, we're frustrated, like the doctor did this and blah, blah, blah. But at this point, whether it's an advocacy organization or a legal representative, they need the facts, because that's how they're going to hold providers accountable. But it's also how we create change, mm-hmm. right? To say, here's like a tangible thing that's being done, that's unacceptable, that does not meet the needs of the patients. And so this is the tangible thing that we want to see mm-hmm. change. So documentation, reporting accurate information, super, super important.
Yeah. And I think you made a very important point there, because sometimes when you're reporting things or you're expressing something through emotion,
yes,
you know, people just take that as emotion.
You're frustrated. You're
frustrated.
Mm-hmm. That doesn't sound right. Yeah, that sounds far-fetched, mm-hmm. right? And it gets lost in the emotion. And so super important to be as rational as possible. Yeah,
because you don't get the response that you are desiring coming mm-hmm. from that emotional space. I always tell my clients, you know, when you are frustrated or upset, any of those negative emotions, give yourself buffer time. Mm-hmm. You got to give yourself buffer time, because of course, if something immediately happens, you're going to have an immediate response to it. And usually it's coming from an emotional place. Mm-hmm. So you have to give yourself that buffer time so that you can really clearly think about, okay, what do I logically need to do mm-hmm. Mm-hmm. In this situation? And again, seeking supports, because this is not something that you have to do alone.
Absolutely.
And of course, spread awareness. Mm-hmm. We talk about, it's so important to just kind of put the word or get the word out there. As we mentioned before, you know, being able to share your own experiences, because 9 times out of 10, somebody else
have experienced, if not the same thing, something very, very similar.
Mm-hmm. And you'll be surprised by the stories. So like you said, it may not be the same thing, but it could be something very similar mm-hmm. or something far worse.
Yes.
That light needs to be shed upon, and changes or policies need to be made around that. Mm-hmm. Because if everybody kind of keeps their own experiences to themselves, mm-hmm. again, that can lead to a space of just isolation.
Yeah.
You know,
and
not
there's
feeling
no
supported.
Space for change there, right? Because no one knows. Everyone thinks like, oh, that just happened to me. Mm-hmm. And so as one, you feel very lonely and you feel like, oh, my one voice can't change. But when you spread and you share your story, mm-hmm. Definitely that will create awareness, and then people will now, you know, one, I think the providers, right, if that's the experience, they're also aware that people are watching, mm-hmm. right? And so that may be enough to invoke some change. But if not, this is how policies are changed.
It is. You have to vocalize these things. Mm-hmm. And I think we've seen that plenty of times, and definitely most recently in our society, of how coming together, for one. So, you know, not just one individual, but kind of grouping together with others, in order to do that, you got to make sure you're on the same page.
Yeah.
So you're going to be sharing your own experiences and things of that nature, but then determining, okay, what changes do we want to see
absolutely
together. So what else can be done? So this was that slide I was mentioning before, where we went through those other ones, and those are more specifically to the individual. What can the individual do? But this one is more so what else needs to be done to address the stigma and discrimination.
Yeah. And I think this slide really, highlights the responsibility of providers, right? Like, it is my responsibility as a patient to educate myself, to know what I need, know what you're offering. But I think it's also the responsibility of providers to understand their population, understand the demographics of the patients that you're serving in the community that you sit in, right? And so your patient may not look the same, right? And so it's your responsibility to figure out what are the needs of the community, and does your practice need to change in some kind of way to meet those needs? And how do you do that in the safest, most, respectful and affirming way? And obviously one of the easiest ways to me is through training, right? So just the same as patients, we need to educate ourselves. Providers need to educate themselves, seek out those trainings, reach out to Zule Consulting. We will train you, train your front desk staff, and just how to, communicate with the community, how to make everyone feel safe when they enter in your space.
Yeah. Those are all very, very good points. And so in addition to that, providing the resources. So near the end of our presentation, we love to see that, so many people are connected to LGBTQ healthcare providers already. And so knowing that there are resources out there, and like you mentioned before, Google is our best friend. There's a lot of ways to, just typing in those specific, things, whatever you're looking for, you can find those resources. And so, and that goes for anyone else that's not even necessarily a part of the LGBTQ plus community, but just being aware of what are these, online resources that I can tap into, should I ever need to support
someone or share, right? And I think that's the key about when you talk about affirming spaces. Sometimes someone may come into your office, or their medical office, into our offices, and just because we're not a part of the community, we still should have resources available and be able to direct people, and also be in a position to call out discrimination and those things, and say like, hey, this is not good. It seems like you may need some additional education or some support working within the community, and be able to provide that.
Right. Yeah. So our last bullet here, changing the healthcare environment, that speaks to what we mentioned before, just as far as, policies and changes like that, which is, I think, is an ongoing process. As we evolve as a society, there will always need to be changes made. So tying that first part up, again, this is not something that you need to do alone. Seek support, partner with others to create the necessary change.
Absolutely.
So our second objective here was the impact of supporting community-based initiatives. And so we want your participation again here. So if you could, in the chat box, could you enter a number 1 if you belong to an LGBTQ plus advocacy organization? So type in the number 1 if you belong to an LGBTQ advocacy organization. And then we also want you to type in the chat if you had to use an LGBTQ plus advocacy organization for support. So let's see what we get in the chat here. Again, type in the chat a number 1 if you belong to an LGBTQ advocacy organization, or a number 2 if you had to use one of those organizations for support.
Mhm. Yeah, I think that's so important, right? Like, because I think there's many ways to support the community. There's many ways to be an advocate. And for some, it's very, very like traditional, belonging to an advocacy organization and kind of being on the front lines, creating marches, or being an active voice and creating policy and change. And then sometimes just as a community member, you need to seek out an agency because you are experiencing some level of discrimination and stigma. And so you need that added support to help you navigate those waters. For sure.
Yeah. So as you see here, supporting community-based initiatives that challenge stigma can have a significant positive impact on individuals, communities, and society as a whole. So we want to just explore some of those key impacts to supporting those organizations. So as you see here, here's a list of what that does when you do that. So we're going to kind of explore these one by one. So first, when we talk about empowerment and self-advocacy, so we kind of mentioned some of that as far as the coping method, but also, as we know, when we're, like you mentioned before, there's power in numbers.
Yep.
So go ahead.
I was going to say just empowerment and self-advocacy, right? Like connecting to an advocacy organization. Again, it helps you. It gives you language. It gives you reference points. It gives you additional support in numbers. And so that all builds your confidence so that you can advocate for yourself. You can feel empowered when seeking services and also calling out kind of those negative behaviors. Because a lot of times, when someone does something to you that doesn't make you feel good, but you don't always know how to articulate that or how to remove the emotion. And so connecting with an organization that have trained professionals that can definitely help you navigate that process, I think is so important.
And like you said, you get into this battle of trying to figure out, is it just me?
Right.
That, am I the one that's taking this wrong?
Right.
What just happened to me? Am I taking this in the wrong way? But it can have in that community.
Right. Because I think people do, like, I think that's a great point, Brandy. Like, people internalize things and say, like, I clearly did something to make you treat me this way. And so it's my fault. So I'll just endure that treatment and then just keep moving. And in actuality, that's not the case. Like, it's just not a safe space for folks. And so unless you highlight that and share your story, then, the community doesn't know.
Yes. And so when you connect with these community-based organizations, of course, I think the main goal is to reduce stigma and discrimination. And so that's going to include bringing awareness to. And I think that awareness, we hear that word so often, but that word is very important because there's so much that we don't know. It could be about anything, whether it's health related stuff, whether it's this community that we're talking about, whether it's poverty in our different communities, any of those things we don't know unless we're kind of exposed to that. So I think the push with any topic or anything that you're trying to put out there, it's important to have that awareness so that other people
and I think that also as we think of evolution, right, like things are changing. When you look at the pandemic, looking at Black Lives Matter initiatives, things of that nature, like just the young people that are now involved, right, that changes what awareness looks like. The impacts of social media, right, like how to get the word out, how to spread the word. In the presentation that we did on Wednesday, we talked about support groups and what that looked like seeking support, say 10-15 years ago versus today. So I think you're right, there's so much we don't know, but I think in the society we have today, there's so many ways to getting the information out that if you really want to know and you really want to be a part of that change, like the information is out there and we need to seek it.
So then we have, of course, this is going to improve mental health and well-being because the main key, and we talked about this a lot, is just that feeling like you're alone.
Yes.
And the challenges and the things that you're experiencing, which we know, isolation and that alone feeling is not a fun feeling and can dive deeper.
Yes, absolutely.
And make you feel depressed. And again, that can move to, okay, I just don't want to do this anymore.
Right. And again, will keep you from getting the treatment that you need because you just don't want to deal with the discrimination. You don't want to deal with that feeling. So I think, yes, the more awareness, the more policy change, it will improve people's overall mental health, physical health, because people will be getting the care that they need. And then you can feel better about yourself overall. And I think that's the goal, right? To have a healthy, full person.
Right? Yeah. And I think the key part is the support that you'll receive. And people, and when I say support, that means those that are around you understand. And if they don't understand, then they're open to understanding. And that makes you feel supported. That becomes your community.
Yes.
And I truly believe, having a community of people that are supporting you. In our last presentation on Wednesday, we identified within the LGBTQ community, they may have chosen
family members,
chosen family members, and that's because of how they feel.
And the fear of discrimination and stigma, and people not accepting their lifestyle. So for sure, you have to really have to invest in your support system and really, be intentional about who you bring into your space to ensure that both mentally and physically you are a healthy and whole human being.
Yeah. And so like our slide says, this fosters resilience. And this is what we're talking about. There's challenges and obstacles, but with connection and collaboration, you can definitely be resilient. And I know that is a protective factor. Your support system is your protective factor. And if you don't have a protective, group or support, that does put you more at risk. Of negative outcomes. So of course, enhanced access to services. So when we're talking about connecting with different organizations and being a part of that, of course, some of their focuses are going to be focused on what are the barriers. To
accessing those services, for sure. And I think, the more awareness we bring, we can identify those barriers. We can, begin to do the work to knock those barriers down so that they're not present. And like the slide said, like, how do we dismantle those barriers, right? We advocate for improved access. Are there providers in our communities that are not saying that they are LGBTQ affirming spaces for fear of what the community may feel about them, right? So now this is one less space for a person to access quality health care. So we want to dismantle those barriers. We want to improve education, improve policy procedures, and just improve access overall for services.
And I think it's, again, the theme of this is, you can't do it alone.
You cannot.
If we're talking about policy changes and things of that nature, as you see there, if somebody wants to change, they're getting a whole list of names of people in support of that change.
Absolutely.
So it's very important to have others who are on the same page so that you guys can, so you all can be a voice for that change.
Yep, absolutely.
So again, connecting with, community-based initiatives, it's going to bring that social cohesion. So I was kind of talking about this a little bit. It's bringing people together, with a like mind, like goals, and making individuals feel supported.
And I think about that when I think about, again, this being Pride Month, right? And so I think, again, if you don't educate yourself, you look at like, oh, it's Pride Month, and it's like all these celebrations and all these parties and parades, right? But not fully understanding, that is birthed out of advocacy, right? And that's birthed out of wanting to be heard and seen and validated. And there were a lot of lives lost, right? Through stigma and discrimination. Just for in 2023 to be able to have pride parades. And so, you know, I think that social cohesion having, you know, and unfortunately it's just 1 month, right? Where a community has to come together and kind of celebrate themselves and show that solidarity, which should be an everyday thing, right? Like you should just be able to celebrate who you are every day. But that is the kind of work that had to go in to make these things happen. And so this is a month where the LGBTQ community can come together in solidarity, celebrate, remember, and then create more change. So I think, you know, that social cohesion and solidarity is super important to create those changes that we want to see.
Yeah, I just think about, as you were talking, I'm thinking about, you know, all the work that has been put in and that's continuing to be put in to create change. It's so, I mean, it's tedious work, and you have to be persistent with it.
The commitment level.
There has to be a level of passion with it. And so it's not easy by any means.
No.
Even with an organization. You can have a whole group, a whole, I mean, 10,000 people. But it's work. So
it's resilience, right? It's about being resilient, showing that resilience, like being strong, understanding the barriers, understanding the stigma, but then putting that action to it and saying like, nope, like we're not going to take this anymore. Like we're going to create change. And again, just that solidarity.
Yeah. So you know, being able to celebrate is worthy.
Worthy, absolutely.
So worthy cause, to be able to celebrate, you know, the wins in the midst of the fight. And so, like we mentioned this a couple times throughout the presentation, systemic change and policy advocacy, that's an ongoing thing. Because I think as we continue to go throughout each day and have different experiences, there's always going to be things that need to be changed. And with time, as you mentioned before, you know, when you mentioned social media and groups, being able to find support groups and stuff like that. Years ago,
you couldn't do that.
It was very hard to access, but now you can just hop online and join so many different communities that could be supportive to you. So things are always changing. So I think this is always going to be at the forefront.
Absolutely.
Things always, attitudes, laws, institutional practices, all of those things have to continue to be looked at and adjusted.
Right. And I think that's important too, just like as we, you know, kind of like also come out of this pandemic. I think about, you know, we talk about stigma and discrimination, but like you couldn't go into a store and sneeze or cough, right? Like, and people were looking at you like you had the plague, right? And so but now all of these policies and changes have come out of that. So what, you know, some states, like being a native New Yorker, like a mask is optional. Some places it's mandatory, right? So just, I think those are just ways that we look at like how there are systemic changes, and due to advocacy, people were advocating against masks, right? People were saying like, don't send the kids back to school, send them back to school, right? But that all became through collective voices and collective advocacy to get us back to a safe society where now, you know, we can get back out, we can get back to parades, we can get back to celebrations, we can get back to just kind of enjoying each other in the same space. So I think that's so important.
Yeah, so I think that just listening to you talk, it made me think of just that accessibility for all, you know, equity for all. And so that's always going to be ever changing.
Absolutely.
Because things are always, we're ever changing. Life is ever changing, and things are always just moving forward. And so with all of that, it creates this ripple effect. Because if, you know, you're connecting with these organizations that are making a lot of noise for changes, that are out there spreading awareness and educating individuals who might not have known anything, or might have known a portion, and then it just either they've gotten exposed to more.
More, absolutely. Yeah.
It creates this ripple effect because it will allow people to understand more. You know, I've said this a couple times, you know, knowledge is power. And I mentioned at the very beginning, everyone, depending on, you know, how you were raised and your different experiences, your values and your belief system, those things get created early on in life.
Yes.
And so through awareness and through openness to others, it will allow you to reassess some of those beliefs and some of those values so that you can fully be aware and open to other individuals around you.
Absolutely.
So it creates a very big outcome. So I think that speaks to why this work is so important and why this topic is so important, so that people can feel empowered and recognize that this is a topic of discussion.
Absolutely. Absolutely.
So this statement here, power statement. So by working together, communities can create a more inclusive and equitable world. And so I think that is a general goal that is, again, unfortunately, a fight to get in the society and the world we live in. So we just wanted to mention and just highlight some of the LGBTQ plus affirming organizations. So we have multiple ones listed here. Fenway Health was one that we really
we really looked into and like had a lot of great information. And I think this list of folks are kind of on that really like national level, global level, right? Like, you know, wherever you are in the world, whatever state you're in, you can pretty much Google them and access their services. And then they may have a satellite or something within that state, but their services kind of speak to, you know, the community and the world as a whole, which I think is important because I think there are those big issues, right? Like there's those big policy issues. And when you talk about systemic change, like these organizations are leading the way. I know for me, being a native New Yorker, Colin Lord is a big organization in New York, you know, where I work for two really large organizations as well in the LGBTQ community. And so, you know, we would also partner with them to ensure that our folks were getting access to LGBTQ affirming safe healthcare, right? To make sure that people are getting what they need. And I know they've really done a lot of great work within that community and ensuring folks get what they need. So I think these organizations are great. And if people have an opportunity, they should just check out their websites and see the services that they offer.
Yeah. And so even if you're not in like high need now, sometimes it can just be helpful, again, being proactive to know what resources are out there. How can some of those resources benefit you or someone else? So, and same thing with us, you know, being therapists, right? You know, we kind of have to have some kind of idea of what resources are there, just in case, you know, someone comes to us and it may not be something we can necessarily address, but at least we know where we could potentially refer them to.
Absolutely.
So this wraps up our presentation, and we are so grateful for your attentiveness and presence during this time that we had with you guys, a little bit over an hour. So we definitely want to say thank you. We have our, you know, phone number here and email address. We do trainings on variety of different topics. The main reason is we just want to, our company name is Azule Consulting Group, and for Azule to us means warrior. And we put that definition to that name mainly because we want to equip individuals and organizations, equip them with the tools to be able to not combat mental health, but know how to navigate it.
Right. And know how to support.
Know how to support, know how to essentially treat people. And particularly, we're talking about this community today. So what are the best methods and interaction And so we are all individuals who have to continue learning. So again, we thank you for your presence. And right now, I think we'll go to just the Q&A, see what we have here. So I see we have one question here. So what advice would you give to someone who is looking for a new therapist / switching therapist? How would you initiate the change with the old therapist?
That's a really good question. I think kind of twofold, right? So I think if a person is looking for a new therapist or thinking about switching their therapist, I think the first thing that I would advise them to do is just kind of be able to identify what is it they feel they're not getting from their therapist, right? So what is it that you want to work on that you feel like your therapist is not maybe, being able to cover in sessions, or just maybe that's not their skill set, right? Like that's not what they do. So I think as clinicians, we all kind of have our niche, as they say, or we all have our specialty areas that, we're really, really fluid in. So I would identify that. And I think have the conversation with the previous therapist, just like, hey, I'm really trying to work on this. I feel like we're kind of maybe at a standstill. I'm wondering, is this something outside of your scope? Just so that to see, because maybe the therapist is just maybe not picking up upon something. And then interview therapists, like,
consultations.
Yes,
Most therapists do free consultations. That way you can really lay out there what your needs are, and they can tell you if they, what they can do to help you address those needs. And again, like I said in this presentation, always pay attention to responses.
Yes.
How you feel about a person's response. Is that reassuring to you? Do you have the confidence in that? And even with your, the current therapist, like you said, having that conversation, just to know that sometimes there is a plateau that you reach with a current therapist. And then that kind of lets you know, all right, if you still have some things to address and you haven't been really able to address it, then okay, this is as far as I can get with this therapist. So yeah, that's our response. Lauren Murphy, I see you wrote something here. It's not a question, but what you both said regarding social cohesion and solidarity, particularly what you said about Pride being a joyful celebration as well as an ongoing fight for justice and change, was beautifully articulated. Thank you for a knowledgeable and passionate presentation. We appreciate that comment. Thank you so much, Lauren, for that. I think with us, we are very, and it's probably because of the profession that we're in. We get clients all the time and we know how we feel.
Yes, absolutely. I think that's the thing. Like for therapists, I feel like there's just a smoother transition of putting ourselves in the position of our clients. And there's like this very cliche saying, like, doctors are the worst patients, right? So I feel like sometimes there's this disconnect when we think about medical providers. Like they forget that they also get sick and they'll have to seek a medical provider. But I think for as clinicians, like we deal in the work so much of human.
So much emotion. We can be sitting in the same space and just feel.
Absolutely.
Someone's feelings.
Absolutely.
And so, we understand. We know how to empathize.
I think that's like the most important word we probably would have used today was empathy, right? Like we recognize we don't sit in certain communities, and so we don't have personal experiences in those spaces. But I think I think part of the privilege we have is that we work with everyone from a variety of communities, and so they invite us into their worlds and into their homes and into their lives, and so we understand what that can look like from a positive and negative. And so we're grateful to be in this space and to have an opportunity to share and learn as well.
So any more questions? We had a great question so far. And a wonderful comment.